Thank you very much.
Sébastien.
Thank you very much,
Bon
Sébastien.
après-midi tout le
And
monde.
good afternoon to everybody.
Good afternoon, everyone. I'm in Moncton, New Brunswick today, so it is in fact the afternoon. I'm joined today by Dr. Tam and Dr. New. To date, 74% of eligible Canadians have received at least one dose of vaccine, with the administration of second doses continuing to ramp up substantially. Thank you to everyone getting vaccinated. In addition to following local health guidelines, getting vaccinated is the single best way to win the fight against COVID-19. Environ 33 millions de doses de vaccins
Approximately 33 million doses of vaccine have been distributed in Canada to date. Over 29 million doses have been administered.
With confirmed deliveries from Pfizer and Moderna, Canada is set to receive more than 20 million additional doses in the month of June alone. Avec des millions de doses qui continuent d'arriver
with the millions
chaque
of doses
semaine,
that are coming in every
le Canada
week,
est toujours en voie de recevoir
is
assez de
receiving
doses de
enough
vaccins
doses
pour
of
permettre
vaccines
à tous les
to make
Canadiens
it possible for
d'être
all
pleinement
Canadians to be fully vaccinated
d'ici la fin du mois de septembre.
by the end of
Nous
September.
continuerons de travailler en
We are going to
collaboration
continue
avec
to
les
work
provinces
closely with
et
the
les
provinces
territoires
and the
que tous
territories
ceux qui le veulent
so
se
that
faire
whoever
vacciner
wants to be
d'ici
vaccinated
là
can
puisse l'être.
be vaccinated.
Comme l'a dit ma collègue, la
As my
ministre
colleague has
Anand,
said,
nous
Minister Anand
continuerons
has
de
said, we will
recevoir
continue
des
to
millions
receive
de
millions
doses
of
de
doses of
vaccins
vaccine
à chaque semaine.
every week.
Cette semaine, ce sont plus de
This
5
week,
millions de
over
doses
5 million
qui seront
doses
acheminées
are
aux
on their way
provinces
to the
et aux
provinces and the
territoires.
territories.
So with that, I would now like to turn to Dr. Tam and then to Dr. New. Dr. Tam.
Merci, Ministre Leblanc. Bonjour à toutes et à tous.
Thank you, Mr. LeBlanc, and hello, everybody.
The 7-day rolling averages remain on a steady decline. The average national case count has dropped by almost 85% since the peak of the third wave to under 1,500 cases reported daily. Likewise, the average number of people with COVID-19 being treated in our hospitals each day has dropped almost 60% since the peak to less than 1,700 daily. Of these, on average, less than 750 people were being treated in intensive care units, and an average of 27 deaths were reported daily. These positive trends give us great optimism, but they also represent a narrow window of opportunity to get ahead of this virus. As we are seeing from other countries where the Delta variant has emerged, getting the population fully vaccinated is crucial for gaining and keeping the upper hand to reopen safely. Getting disease rates as low as possible by staying vigilant with personal precautions and infection prevention measures while increasing public health capacity to limit spread and prevent outbreaks will create the environment for stronger and longer lasting control of COVID-19. Canadians are playing a very important role in getting us to where we need to be. With close to 30 million doses of COVID-19 vaccines given across Canada by end of today, people are contributing to COVID-19 control before our eyes. Canada's plan prioritizes vaccines to those at highest risk of COVID-19, then quickly expanded to other age and risk groups. As vaccine supply has ramped up, implementation of the plan has also accelerated, and now we're seeing the benefits of high coverage, including reduced illness and death among the most vulnerable populations. Throughout, programs have continued to adapt to ensure vaccinations could be optimized across the country. Most importantly, Canadians have stayed engaged and stepped up individually and collectively to turn availability into the great results we are seeing. To keep the momentum going, we're passing the baton for COVID-19 vaccination with the help of Canadian Olympians and Paralympians. You can join this relay of reasons of why it's important to get vaccinated by using #MyWhy on social media to share your reason. Whether it's to protect your parents and grandparents, get back to activities that connect us. Use your story to reassure and motivate others. Finally, as we share our reasons for being vaccinated, having information from trusted sources is also crucial for informed and confident decision-making. This week, the Ask the Experts initiative will launch to provide answers to your important questions about COVID-19 vaccination. So keep an eye out for more on this and tell others. Working together, we can make the best of this window of opportunity and go for gold to get Canada vaxxed to the max. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous. À l'échelle nationale, les moyennes sur 7 jours continuent d'être en baisse constante. Le nombre moyen de cas à l'échelle du pays a diminué de 85% par rapport au pic de la troisième vague et est passé à 1300 cas déclarés par jour. Et même le nombre moyen de personnes atteintes de la COVID-19 traitées dans nos hôpitaux chaque jour a diminué de près de 65% depuis le pic pour atteindre moins de 1600 cas par jour. Parmi ces personnes, en moyenne, un peu plus de 700 ont été traités dans des unités de soins intensifs et 25 décès ont été déclarés en moyenne par jour. Ces tendances positives nous rendent très optimistes et représentent également
But they also represent a narrow window of opportunity to get ahead of this virus.
Comme nous le constatons dans d'autres
As we're seeing
pays
from other
où le
countries in
variant
which the Delta variant has
apparu,
emerged,
il est crucial de vacciner
it's
complètement
crucial to
la
get the population
population
fully
pour
vaccinated
prendre et
in order to
conserver
gain and
l'avantage
keep the
afin
upper
de
hand
rouvrir en toute
in order
sécurité.
to reopen
C'est en
safely.
maintenant les taux de maladie
Getting
aussi
disease
bas
rates
que
as low as
possible,
possible
en
by
restant
staying
vigilant
vigilant
dans
with
l'application
personal
des
precautions
précautions personnelles
and with
et des mesures de
infection
prévention
prevention
des
measures,
infections, tout en augmentant
while
la
increasing
capacité de
public
la
health
santé
capacity
publique pour
to
limiter
limit
la
the spread
propagation
and
et
prevent
prévenir les
outbreaks
éclosions que nous
will
créerons
create the
un
environment
environnement où nous pourrons
for
maîtriser
stronger
efficacement
and
et
longer
de
lasting
façon
control
durable la
of
COVID-19.
COVID-19.
Les Canadiens jouent un rôle très important pour
Canadians
nous
are playing a very
amener à
important
là
role in
et
getting
nous
us to
devons
where we need to
être
be.
par l'atteinte de près de 30 millions de doses de
With
vaccins
nearly
contre
30
le
million doses
COVID-19
of COVID-19
administrés au
vaccines given
Canada
across
d'ici la
Canada
fin
by
de
the
la
end of the day
journée, les
today,
gens
people
contribuent
are
à la
contributing
maîtrise de la
to COVID-19
COVID-19
control
sous nos
before
yeux.
our very
Le
eyes.
plan du Canada a donné la
Canada's plan
priorité de
prioritized
vaccination
vaccines to
aux
those at
personnes
high
les
at risk
plus
of
exposées à la
COVID-19.
COVID-19, puis a rapidement procédé
And
à
then
d'autres groupes d'âge
the plan
et
quickly
groupes à
expanded to
risque.
other age and risk
Avec
groups.
l'augmentation et de l'approvisionnement en
As
vaccins,
vaccine
nous
supply
avons
has ramped up,
exécuté le plan plus
implementation of the
rapidement
plan has
et
also
nous
accelerated.
constatons maintenant
And
les
now we are
avantages
seeing the
d'une large
benefits of
couverture,
high coverage,
notamment la
including
réduction des
reduced
maladies,
illness
des
and
décès
reduced
parmi les
deaths among the
populations
most
les plus
vulnerable
vulnérables.
populations.
Tout au long de cette période, nous avons
Throughout
continué
this
à
time,
adapter les
programs have
campagnes de
continued to adapt to
vaccination
ensure that
pour
vaccinations could be
optimiser la
optimized across
couverture
the
dans tout le
country.
pays. Mais surtout, les Canadiens sont restés
Most
engagés
importantly,
et se sont
Canadians have stayed
mobilisés
engaged and stepped up
individuellement et
individually and
collectivement
collectively
pour que
so
la
as to turn
disponibilité se
availability of
traduise
vaccines
par les
into the
excellents
great results that
résultats
we're
que
seeing.
nous constatons. Pour survivre sur cette lancée, nous passons le
To
relais
keep
de
this
la
momentum
vaccination
going,
contre
we're
la
passing the
COVID-19
baton for
avec l'aide des
COVID-19
athlètes
vaccination with the
olympiques
help
et
of Canadian
paralympiques
Olympians and
canadiens.
Paralympians.
Vous pouvez vous joindre à ce relais des raisons
You can
pour
join
dire
this
pourquoi il
relay
est
of
important
reasons
de
of
se
why
faire
it's important to
vacciner
get
en
vaccinated
utilisant
by
mots-clics,
using
mes raisons sur les médias sociaux
#MyWhy
pour
on
donner
social
votre
media
raison.
to share your
Qu'il
reasons,
s'agisse de protéger
whether
vos
it's to
parents
protect your
et
parents and
grands-parents
grandparents,
ou de reprendre
to
plus
get back to
d'activités
activities that
que nous
connect
lient.
us.
Utilisez
Use your
votre
story
histoire
to
pour
reassure and
rassurer
motivate
et
others.
motiver les autres. Enfin, alors que nous exposons nos
Finally,
raisons de nous
as
faire
we share our
vacciner,
reasons for being
il est
vaccinated,
également
having
essentiel de
information from
disposer
trusted
des
sources is
renseignements
also crucial
provenant
for
des sources
informed
fiables
and
pour
confident
prendre des
decision-making.
décisions éclairées et en toute confiance. Cette semaine, l'initiative Demandez aux experts
the
sera
Ask the
lancée pour
Experts initiative
apporter des
is going to be
réponses à vos
launched.
questions
And this is
importantes
intended to
sur
provide
la
answers to your
vaccination
important
contre la
questions about
COVID-19.
COVID-19
Alors
vaccination.
soyez à l'affût
So keep an
pour
eye
en
out for
savoir
more on
pour
this
plus et en
and tell other
parlant
people
à
about it.
d'autres. En travaillant ensemble, nous pouvons
Working
tirer le
together, we
meilleur
can make the
parti
best of
de
this
cette
window of
occasion et
opportunity,
vision-là
and we can
pour que
go
le
for the
Canada
gold
soit
to get
vacciné
Canada
au
vaxxed
max.
to the max.
Merci.
Thank you.
Merci.
Miigwech.
Merci beaucoup, Dr. New. Alors,
Thank you, Dr. New.
à vous
Jean-Sébastien,
à Ottawa. We're
over to you
obviously
in
now
Ottawa.
happy to take questions. Over to you, Jean-Sébastien.
Merci beaucoup, Monsieur le Ministre.
Thank you very much, Minister, Dr. Tam and Dr. New.
Tel que mentionné, nous allons maintenant débuter la
we'll now
période
begin
de
the
questions.
question
We
period.
will now be taking questions. As usual, it will be one question and one multitude. Vous allez avoir une question et un suivi. And I will now pass it over to the operator for the first question. Donc, je vais maintenant passer la parole à l'opérateur ou l'opératrice pour la première question.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Tonda McCharles, Toronto Star. Please go ahead. À vous la parole.
Hi, my first question is for Mr. LeBlanc. Minister, last week you told us there was domestic agreement among all the provinces on what certification of vaccination in Canada could comprise of, and I gather that means you've agreed on some kind of data or protections around privacy and certification of the science, but can you explain to me a little bit more how this could work? Especially when Alberta and BC have already said that they're not really interested in proof of vaccination or certification, issuing that kind of thing. So if you could just explain to me sort of where you're at domestically in terms of producing some kind of a document that looks similar across the country to certify vaccination.
So, Tonda, thank you for the question. And I think after the First Minister's conversation a few weeks ago, there was a broad consensus to continue to work together around the issues of proof of vaccination with respect to international travel. That's properly, obviously, the area where the Government of Canada is going to remain focused, but the provinces, by virtue of their jurisdiction, have ownership of the health information, the vaccination information regarding their citizens. So the conversation a few weeks ago, and it's been ongoing between deputy ministers of health, intergovernmental affairs, the deputy clerk of the Privy Council chairs a working group where these issues are discussed. And what we're doing is working with provinces. The lead would probably be my colleague, Minister Mendicino, Marco Mendicino, who has responsibility for passports. And the idea would be to find the best common secure platform for Canadians who want to have proof of vaccination in the context of international travel. Whether some provinces choose to have vaccination proof as a requirement for certain public activities or certain gatherings, that is properly a provincial jurisdiction. We don't have a federal government view with respect to that. We are working with allies, obviously in the European Union, the United States, and others, to find the most appropriate way to recognize proof of vaccination for citizens who want to travel internationally. This has existed in a number of countries, in a number of regions of the world for many, many years. So it's not new, but the urgency of coming up with a secure, reliable, probably digital proof of vaccination is something that we're working on collaboratively with provinces. And there may have to be a transitional measure, for example, if there's a phased adjustment of border measures in July or later in August or so on, there may be a transitional measure, but we'll have more to say about that in the coming weeks. But it's a collaborative effort to respect provincial jurisdiction around the data, the healthcare data of citizens, but at the same time accepting that the international context will, in all likelihood, require some reliable national proof of vaccination, and that's what we want to do collaboratively with the provinces over the next number of weeks.
Thanks. My follow-up then, so just looking at the idea that people need something to travel with, I'm curious as to what's going on with the Canada-U.S. border. I guess the Prime Minister and the President met well on the sidelines of the G7 summit. Can you speak to us a bit about where the two countries are on this border reopening and how that can proceed, given the U.S. has also said that they're not interested in issuing, a credential, vaccine credential. So could we end up, for example, where Canadians might be required to produce some kind of proof to the U.S., but Canada can't demand such a credential of U.S. citizens coming in here? I'd just like to understand a little bit about where that stuff is all at.
Sure. So those are obviously ongoing conversations. My colleague, Bill Blair, our Minister of Public Safety, has been having discussions with his American counterparts around particularly the land border, the Canada-U.S. land border. We have worked collaboratively with the Americans since the beginning of the pandemic on a common posture at the land border. So as vaccination rates go up in the country and as case counts hopefully continue to come down, as we've said over the last number of days, we'll have more to say around what a phased approach might look like at all of our international borders in terms of perhaps adjusting certain measures. Obviously, with respect to the land borders, there has to be an ongoing collaborative dialogue with the Americans. That's exactly what the Prime Minister and the President discussed on the margins of the G7 summit in the UK last week. But as I say, the details of those conversations are properly being led by Bill Blair, supported obviously by the Foreign Affairs Minister, Marc Garneau. We'll have more to say as our posture evolves. As you know, the orders in council which govern the specific measures at the borders, amongst other things, are renewed on the 21st of each month. So before the 21st of June, we'll obviously have something to say around these measures being rolled over and look ahead to possible adjustments over time, as we discussed last week.
Thank you, Minister. Operator, next question.
Thank you. Merci. The next question is from La prochaine question est de Mia Robson, the Canadian Press. Please go ahead. À vous la parole.
Hi, good afternoon. Dr. Tam, I'm just wondering if we have any knowledge or understanding yet of how many people will need to be vaccinated in order to sort of get the variants like Delta under control. We've talked about the 75%, but I know you've also said that that's maybe just sort of an initial target, and maybe wondering if Delta has increased the number of people who need to be vaccinated in order for us to really have herd immunity against the COVID-19.
Yes, it's Theresa Tam here. Thank you for the question. The modeling information that we previously presented was looking at what would be the vaccine coverage in terms of informing the lifting of the more restrictive public health measures in order not to overwhelm the healthcare system. Now, that is a bit different from herd immunity. So that's what that modeling showed. And we inputted different parameters for transmissibility, for the virulence or the seriousness of the health outcomes from different variants. And at that time, the Delta variant was not part of that calculation or modeling. If we model the Delta variant now into that and input that into that model, with a higher transmission variant, it does mean that the even higher vaccination coverage would be, even better at protection against the hospitalizations and overwhelming the health system. But the other measure is the fact that this variant seems to increase hospitalization. So that also has to be built in, which means that, again, it comes down to our bottom line, which is 2 doses now are better than 1. So aiming for that 75-75 is actually the key in terms of vaccine coverage for us to have the kind of community level of resilience, if you like, against variants of concern that are more transmissible. Should we aim for higher? Yes, I think we should. As I said, shoot for higher, shoot for gold, shoot for the stars. That gives us a better buffer for managing the COVID-19 situation. What was heartening to me was some of the results we saw from Scotland and from England, which suggests that while the Delta variant needs 2 doses, ideally to protect us against infection and symptomatic infection, vaccines are actually very effective in preventing hospitalizations. So that's the new piece of good news that we're looking at. So when we're assessing things like border stance, for example, we'll take all of this into account. But if we continue on our current trajectories of the epidemiology, and if everyone continues to roll their sleeves up, then looking at that beginning of July timeframe is within our reach.
Thank you. And you mentioned earlier that, we sort of are in a window where we have low cases and vaccines are ramping up, but that the Delta variant is sort of a concern. We saw yesterday that the United Kingdom has pushed back its final reopening plans because of Delta. What impact should it have on decisions for provinces who are starting to move towards more reopening, particularly with indoor spaces?
Yeah, so cautiously and in stage manner with an interval between each of those stages and watch what happens when you ease the initial measures is very important at this point, when you only have 1 dose in most of the population that's been vaccinated. So I don't think that advice changes. But the other thing is keep up with the testing. Of course, when the number of cases are going down, we're doing less testing, but we do have to maintain a broader approach to surveillance and to be able to detect if the Delta variant is increasing in certain areas. So the lab testing and the sequencing capacity has to be there for the lifting to occur. And for the most part, based on what I've seen, provinces are able now that the cases are down, to be able to follow up with each of these cases, and many of them are already screening and then sequencing almost all of those cases. So we do have that's one of the parameters that we'll be looking for. But I am providing a word of caution that between now and the 2 dose goalposts, we have to be as careful as we can.
Thank you, Dr. Tam. Operator, next question.
Thank you. Merci. The next question is from, la prochaine question est de Rachel Haynes, CTV News. Please go ahead. À vous la parole.
Hi, Dr. Tam. As we're moving up with the 2nd dose regime now for a lot of Canadians, a lot of doctors are saying that the Moderna and Pfizer doses and vaccines are now interchangeable guidelines that came out a few weeks ago. However, you said that it's not necessarily interchangeable, but they can be used in certain circumstances. Do you believe that Canadians should be using the Pfizer and Moderna interchangeably, especially as there are now more pop-up clinics and more access to getting those 2nd doses?
Yes, I think the most important thing is to get that 2nd dose. And where possible, certainly getting 2 doses of the same vaccine. But as per the recommendation of the National Advisory Committee on Immunization, depending on where you are and what the supply situation is, if the 2nd dose of mRNA vaccine is the other one, so the one that you had obtained, that is okay as well. So I think it depends on what is being offered at your local level. but these two vaccines are off the same platform. So I think the expert advice is that they can be used interchangeably.
Thank you. The CDC, however, in the United States has said that they shouldn't be used interchangeably and that there's not enough data to say whether or not it's effective and safe. So why is Canada on a different page than the CDC in the United States when it comes to recommending either Pfizer or Moderna as a second dose?
Yes. Now, I have to say that for Canada, we've been providing our vaccine strategy based on the recommendation of the National Advisory Committee on Immunization all along. And we've done really well as a result. And we have been different from the approach used in the United States on many fronts. But the National Advisory Committee on Immunization is looking at the safety, but also at the body of knowledge we know about vaccines. So I recall when they first came out with that recommendation, we went through a number of the criteria or the considerations that they had taken into account, and that is available in the NACI statement itself. So changing the type of vaccine or the make of the vaccine that's of the same technology is something that we've done over many decades with different vaccines. Childhood vaccines, hepatitis A vaccine, influenza vaccine. You don't get the same influenza vaccine necessarily either consecutively. So that's one of the criteria. Two is that yes, they are off the same technology. Three is that they in fact both target the same spike protein. That is really important, and they've performed in really fairly similar ways when you look at the clinical outcomes of people who receive these two vaccines. And so I think with all those pieces in looked at in a systematic way, that's how the committee came up with a vaccination approach. And we're not the only country either. So sharing the data across the world, particularly on safety, but certainly on effectiveness, as these different schedules are being used, is an ongoing measure to ensure safety and effectiveness of our vaccines for Canadians.
Thank you, Dr. Tam. Operator, next question.
Thank you. Merci. The next question is from La prochaine question est de Tom Perry, CBC News. Please go ahead. À vous la parole.
Hello, thanks for taking our questions. I was just wondering, Health Canada announced on Friday that it was not going to distribute those doses, those 300,000 doses, I believe, of Johnson & Johnson, a single-dose vaccine. I'm wondering if you know what happens to those doses now. Do they go back to the factory? Do we destroy them? And also, Dr. Tam or Dr. New, do you see any role for the Johnson & Johnson vaccine in Canada's vaccine strategy, given I guess concerns about VIT and also, I guess, the abundance of mRNA vaccines that we're seeing coming into the country?
So I will start. So the regulator, Health Canada, has not released the shipment of Janssen vaccine, and that is the implicated vaccines from the emergent site. So the company itself has the discretion to decide what it would do with it, but essentially it will be given back to the company. What actually happens to it afterwards, I can't say. But from a from I guess the supply arrangement perspective, Janssen will have to make up for the doses. As to whether we need the doses, though, that is what we're actually doing some detailed work with the provinces and territories. Depends whether they would use any future Janssen doses. I do think that with the supply of mRNA vaccine coming in and the fact that so many people in our country have already received that first dose anyways. The opportunities to use the Janssen vaccine then is much lower. You're only looking at the populations that's never had a dose of vaccine. So I think that there'll be very limited use of this vaccine going into the future. But we will, I believe that Brigadier General Krista, I'm just blanking on the name now, Brody. Exactly. One of those moments. Brigadier General Brody is finalizing the estimates with the provinces as to whether they will use this vaccine at all. So stay tuned on that one.
Sure if PHAC actually has any say in this, but the U.S. Congress is actually looking at a bill this week to ban PFAs, which I believe are perfluoro and polyfluoroalkyls in cosmetics. And I guess there's concerns that there's fear that they could be toxic, they could be carcinogenic. I'm wondering if that's something that is a concern that PHAC's looking at, if that's something that Canada should be looking at, banning these kinds of materials.
I can't actually answer your question, and it should be posed to our Health Canada colleagues who are the regulators, and we'll ensure our media relations follow up with you.
Thank you, Dr. Tam. Operator, next question.
Thank you. Merci. The next question is from La prochaine question est de Charlie Pinkerton, iPolitics. Please go ahead. À vous la parole.
Hi. Due to a shortage of ministers here, I will be asking Minister LeBlanc my questions. Minister, the co-chair of the COVID-19 testing and screening expert advisory panel said yesterday at the Health Committee that the panel delivered its report suggesting that hotel quarantines be done away with to the government on May 2nd. We know that report was made public on, I believe it was May 27th, but before then, on May 21st, the government again extended this system that it's now indicating it will be moving away with for fully vaccinated people in early July. So what I'm wondering from you is, why was this decision made then, when the report that the new system is being based off of was in the government's hands and within its knowledge?
So thank you for the question. We've said since the beginning of the pandemic that what was important to protect Canadians was a series of layered measures at the borders involving, as a basic primary measure of protection, obviously the 14-day quarantine period. We've added different periods of testing requirements. We've used no-TAM orders to suspend flights, direct flights from certain jurisdictions when the public health advice said it was appropriate to do so. And the government-approved accommodation was, again, another level of protection, which we thought was important to have in place to allow people to wait for a negative test result, a PCR test result, taken upon their arrival in Canada. So those were a series of measures that were stood up at the 4 international airports. As you noted, we have said that obviously as a function of vaccination rates, but also we hope of declining case rates and circumstances that are appropriate around, for example, the Delta virus, that at the rollover of the orders in council on the 21st of this month, next week on the 21st of June, we'll have more to say about measures that will be in place at both the land borders and the air arrivals at the 4 designated airports. So this is, and my colleague, the Minister of Health, also wanted to talk to her provincial and territorial counterparts. We have talked about border measures on a number of First Ministers' calls that I've been on. Dr. Tam has participated in some of those as well. So we'll continue to talk with our partners and to have in place the best combination of measures necessary to protect Canadians. But the good news is that we hope and believe these measures can evolve in a phased, appropriate way over the next number of weeks, and we'll have more to say about those specific measures and those details, the implementation details, in the coming days.
Okay. You've alluded to, in response to my question, in response to my colleague Tonda's questions earlier, to this upcoming June 21st date for when there's a number of things that have to expire on that date. So I'm wondering, perhaps more about that, or looking more into the future. We've seen in the provinces, and particularly in Ontario, with businesses having to scramble to change their plans based on various reopenings. Is your government going to give Canadians who wish to travel and Canadian businesses who rely on travel, the border, a plan a certain amount ahead of time about when travel and the border will reopen? And when might we hear that plan? It sounds like it could be within the next few days. Am I gathering that correctly?
As we've said, the renewals of the orders in council, the measures that set up the legal framework for example, border requirements or other measures, testing requirements, those are renewed on a 30-day period on the 21st of each month. So we talked last week, I think, about evolving those measures in a phased, cautious way as vaccination rates continue to rise and as case counts hopefully continue to decline. We also, obviously, the travel within the country between Canadian provinces is properly something that provincial authorities have to consider. And I know a number of premiers, as you noted, have publicly discussed various stages of their reopenings of their economy and of measures in terms of interprovincial travel. We're focused on the international borders, arrivals by land at the border crossings of the Canada-U.S. border, and also international air arrivals. We also recognize, I've spoken with executives at the major airlines and people from the tourism and hospitality sectors, and premiers constantly talk to us, understandably, about giving the best line of sight possible to, as you said, sectors of their economy that are looking forward to being able to reopen in an appropriate, phased, cautious way. Obviously, the tourism sector, I don't have to tell you, I'm speaking to you from Atlantic Canada this afternoon. The premiers, certainly in my region, but across the country, talk to us about their hopes at giving the tourism sector some opportunity over the next number of weeks. But we have to base decisions around borders based on the scientific and the medical advice that we get from Dr. Tam and her colleagues and from other experts who also feed into this conversation. So in a perfect world, we would have been able to set dates certain with a very long sort of runway. But unfortunately, COVID hasn't given the world this opportunity. And one of your colleagues referred to some of the changing positions in the United Kingdom as a result of the Delta variant. Just to use one international example, Canada's not immune from having to make those adjustments, but we're going to do whatever we have to protect the health and safety of Canadians, but at the same time, work in a collaborative, constructive way to give as much visibility as possible to people who understandably are anxious to plan certain trips and certain travel, certain family reunifications. But all of that has to be a function of the advice that we get at the particular moment those decisions are made in terms of the best way to continue to protect Canadians.
Merci, Monsieur le Ministre. Operator, prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Marika Walsh de Globe and Mail. Please go ahead. À vous la parole.
Good afternoon, Mr. LeBlanc. I'm wondering if you can clarify for us when Ms. Atwin first began speaking with anybody connected to the Liberal Party. Was it before her dispute with the leader of the Green Party about Israel and Palestinian crisis on May 11th, or was it after?
So I obviously can't speak for Ms. Atwin and the conversations that Ms. Atwin may have had with various people. I think my first conversation with her was the last week of May. I was in Fredericton for some other business and discussed with her these issues and how we could work in a collaborative way to help the people of Fredericton and what she could do to best serve the constituents that had elected her in Fredericton. That conversation, I think, was May 27th. It had come to my attention some days earlier that she was having some challenges within the Green Caucus, within the Green Party, and I thought it would be interesting for me to be able to have that conversation. And we had an amicable but inconclusive conversation. I think it was on May 27th. But as I say, it focused on how could she best serve the people of Fredericton and help the people that had elected her do things that are important for her constituency. And then we resumed the conversation, I think, a week or 10 days later.
Thank you. And what role did her position on the Israeli-Palestinian conflict have on the Liberals welcoming her into their caucus?
Well, I think it goes without saying that the position of the Liberal Party and of our government with respect to Israel has been clear and has been consistent for many, many years. The government and the Liberal Party are committed to a two-state solution, strongly recognizing and supporting Israel's right to live in peace and security with its neighbors. So that position has been clear and has been reiterated by both the Prime Minister and Mr. Garneau on a number of occasions. I think in terms of Ms. Atwin, I certainly can't speak for her, but the statement that she's made this week, I think shows a great deal of character. It shows her sincerity. It shows her desire to reach out and have difficult conversations with colleagues who have views on these obviously highly sensitive questions. Her statement speaks for itself. As I say, it says something I think very compelling about her desire to be collaborative and to work with colleagues, and also her sincerity and her character on these issues. I can also say that in my conversations with Ms. Atwin, we have been focused to an enormous extent, as I said a moment ago, on what we can do to help her as a government serve the constituents of Fredericton. From my very first conversation with her, her focus was where can she best serve the people that elected her. She made a very tough decision, a very courageous decision, and one that we certainly think will be in the best interests of her ability to continue to effectively serve the people that have elected her.
Merci, Monsieur le Ministre. Opératrice, prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Ryan Tumulty, National Post. Please go ahead. À vous la parole.
Yeah, hi there. This question is probably mostly for Dr. Tam. I'm wondering if you are starting to look ahead into maybe August and September in the fall about how to manage a world in which Canada is heavily vaccinated, but the rest of the world isn't. I know some countries have opened up certain lists of countries that can transfer into their countries without heavy screening or quarantining. Are you starting to look at that or to some sort of surveillance network to manage a world in which COVID will still be out there, but maybe not a big threat to Canada?
Yes, thank you for that question. Absolutely, I think looking ahead is really important, and then everything is about the details after that. Broadly speaking, though, I am discussing with the provinces and territories on what would the world look like after we've achieved very high vaccination rates. The bottom line, though, is that the public health capacity must be maintained in terms of our testing, sequencing, contact tracing, and then isolation capacities. Be able to react nimbly to any introduction and flare-ups, which at that point in time, hopefully will be detected and managed rapidly. As we don't expect to have huge number of cases, the provinces should have the capacity to be able to do that and investigate the outbreaks and look to see if there's actual changes in the virus itself. So that's pretty critical. The international border, I think, recognizing that other countries are not maybe in the same situations that we are, of course, is providing advice to people traveling overseas, which at this point in time, as you know, we advise against travel at this point to other countries. But Canadians can always go someplace, so we need to make sure that they know that there'll be requirements from other countries. They know that the epidemiology is different and that they know what to do when they come back. I think that in a world where we try to separate different countries according to risk is one way that some countries are managing their futures. We're looking, we have been actually looking at a broader approach where it is about layers of protection, and that we would look at vaccinated travelers and see how we can remove some of those layers in order for them to come to Canada and not put the country at risk. So I think one would expect a continual, perhaps, distinction for a period of time between those that are vaccinated coming in and those who are not, until there's such a time as we can tolerate the risks in Canada, no matter whether someone is vaccinated or not. And that will be further out into the future, and we would not be able to pronounce on that at this point. But I think one would expect the borders are not going to be the same as what they were before the pandemic, and that additional measures will be applied for a significant length of time until the world is in a different place. And we have to provide, I think people have asked lots of questions about support to other countries, and the Prime Minister is undergoing those kind of discussions with others.
Follow-up, Brian?
Yeah, just as a follow-up to Minister LeBlanc, you've mentioned a few times today this upcoming deadline of the 21st when the orders and councils roll over. I'm wondering if you're saying that, without getting into the specifics of how the rules will change, that we should expect some rule change on the 21st of this month.
Well, this shouldn't be a surprise because we talked about potential measures that could be phased in at some point in July. We talked about that, I think, a week or probably 2 weeks ago. So the technical date on which the orders in council are renewed is the 21st of the month. But I know I said in a previous news conference that we may signal in the renewal of these orders in council some modest phased-in adjustments at the border, but with a date fixed by the order in council to take effect. It doesn't have to take effect on the 21st of June. So we're looking right now, we're talking inside the government, across the government of Canada, with obviously partners like the Border Services Agency, but with the Public Health Agency and Health Canada obviously in the lead. We're talking across federal departments, as we do every time these orders in council are renewed. We've been doing it now for over a year and a half, and we'll have more to say in the coming days around a phased-in approach at the border. But it's not new. We had talked about it in the past, and as I said, it would normally be signaled in these orders in council rollovers, but at a date that can be fixed sometime after the 21st of the month.
Thank you, Minister. And we'll have time for one more question. Donc, Opératrice, à vous.
Thank you. Merci. The last question is from. La dernière question est de Cormac McSweeney, City News. Please go ahead. À vous la parole.
Hi, this question I think is likely for Dr. Tam. We've talked about how we could be opening the borders for fully vaccinated travelers, and I know that you've been asked about this in the past, but I'm wondering if you could give an update when it comes to specific advice for people who are fully vaccinated within Canada. The CDC has had more specific guidance than we've had for weeks now on what they can do, such as where exactly they can ditch the mask, where they still need to have it at this point in the pandemic. So I'm just wondering where you are in those conversations and when Canadians can expect some more specific guidance about fully vaccinated people and what they can do within our borders.
Yes, so first of all, of course, you have to take into account local epidemiology as well as your personal vaccination status. And so I think, obviously, the local public health will have very specific instructions as to what's going on in their community. But things are looking, all to be moving in the right direction. We do have the Delta variant that we're concerned about. And you have seen outbreaks where some people are vaccinated and can still get the virus. So I think what we would provide is that individuals need to take a personal risk assessment. And we've been advocating for that ever since the, many, many months ago, is that not everyone is the same. Their own context and risks and the risk tolerance might be quite different depending on whether you have underlying medical conditions, if you are a senior, etc., and what context you are actually living or working or doing other activities in. So I think what we will provide is a risk, it's like a personal risk assessment framework in terms of considering your own vaccination status, but that you can control. You can choose to get vaccinated. The other thing you can control whether you still need to wear a mask and how you would control, whether you're able to control the environment that you are doing that activity in. That is actually quite important in your level of risk tolerance, because if you have total control over your environment, you know exactly who is in there and you know who is vaccinated, for example, in another family that you are thinking of doing activities with, that puts you in a very different safety mode. So I think that is what we're trying to plan for, but it's not a one size fits all. But so those kind of considerations, just to repeat that, your vaccination status and your personal protective measures are under your control. The level of virus circulation in your community may not be. You've got to watch that and see what's going on and whether variants that escape vaccines are circulating. And then you need to know who you're with and what circumstances are happening. And do you know what the vaccinations might be for the people that you are about to meet with? So I think one might expect that kind of approach to be provided. But in Canada, we've always promoted the need for the whole community to reach certain levels of vaccine coverage. Why? Because not the vaccines are never 100% effective. You need each other's protection. So protect yourself, but you protect others as well, so that those who cannot get vaccinated or those who cannot respond well to a vaccine because of an underlying immune condition can be protected by others as well.
So just as a follow-up then, if we are, if I understand you correctly, there's work underway on some sort of risk calculator or some sort of document where Canadians can look this up, because not everybody's an epidemiologist and able to figure this out just based on current trends in their neighborhoods. So when exactly will we be able to get something that regular Canadians who don't track this day to day can look and say, yeah, I'm fully vaccinated and I can do X, Y, Z based on the scenario in my hometown?
Well, first of all, you do have to know your hometown and what's going on there and follow local public health advice. I think that's the first piece. You got to track and listen to your local, but they will have rules and they will be relaxing them in different ways. So then in that context, and we've always promoted that approach, which is you have to know your personal circumstances and how high risk you might be from the consequences of COVID-19, and avoid close, crowded conditions where you cannot separate yourself from others. Those kind of things can still hold. And I think Canadians are used to that kind of approach and thinking about the environment. But we are discussing this with the provinces, and I think that we will be providing that kind of tool, if you like, that people can use. But really is about everybody getting 2 doses of vaccine and protecting each other. Otherwise, how are you supposed to go check someone else's vaccine status? This is not the way that most communities are working. And so that is really, really important to understand, that you can't always do that. But I do think that, social bubbles, you have a social contract, the other family, that kind of thing can still take place. And that has taken place whether you had vaccines on board or not. What the vaccine does is add yet another layer of confidence that you have about your safety. So in any case, I think all those kind of messaging and approaches are being provided at a local level, but we are also looking at the tools that might be helpful to people at the national level as well.
Thank you, Dr. Tam. Donc, voilà qui met fin à cette conférence de presse. That marks the end of the press conference. Merci. Thank you.
Merci beaucoup. Bon après-midi.